my filmmaker and partner on the film, Jessica Yu, and I had done a documentary about water. And when we were traveling with that film, the question that kept coming up was about population. And how can we address any of these other issues if we're not looking at the underlying cause of overpopulation? And we got interested in that idea and started researching it and realizing that there are so many myths and misconceptions out there about population, and really we needed to be talking about women and looking at women's stories. And we were looking for a story about how to bring to life this idea of kind of unmet need and what's really happening with women. And we found Gladys, and we thought that through her story and her eyes, we could really look at what's happening to the consequence, and then going back to the underlying causes, as you were saying. And she's just such an incredible, inspiring woman, and she really kind of got under our skin, and we felt like she was a great way to introduce people to this broader subject.
First of all, I'm so honored to be on this panel with Elise, because I think this film is fantastic, and if you have a chance to see the entire film, I highly encourage it. So,
thank you. Yes, Sarah.
UNFPA works around the world with partners such as Gladys and in other countries, trying to ensure that all women have access to quality health care, including family planning and reproductive health. And I guess one story that I always try to talk about that kind of gives you a flavor of this is when I went to the country of Ethiopia. Ethiopia has a population of 95 million people. And in that country, for context, they have 200 OB-GYNs. So the likelihood, if you're a pregnant woman in Ethiopia, that you're going to have a birth assisted by an OB-GYN is probably pretty slim. And there I met with a OB-GYN who probably had a patient population of 5 million people. And when we met with him and we said to him, he told us that every day he was losing 2 or 3 women, because by the time they got to his clinic, they were pretty far gone in terms of what complications they were having. And we said to him, wow, you're such a hero to be doing this work. And he was like, I'm not a hero. He's like, he's like, could you get me a job in the US? And that's one thing that the Minister of Health in Ethiopia always says, is that there are probably more Ethiopian doctors in Chicago than there are actually in Ethiopia. So, we said to him sort of like blue sky, like, well, what could we do if we could like wave a magic wand? Like, what would you want? Would you want a helicopter to bring in patients? Would you want, some kind of ambulance? And he said, if you could do one intervention, he said, bring family planning. When women are able to time and space births, when they can have good healthy outcomes, when they don't have one pregnancy right after, they're able to participate in economic life, political life, the life of their community, and they have healthier, better birth outcomes. So that's one anecdote.
MAMA was launched by former Secretary of State Hillary Clinton about 3.5 years ago. And we're a public-private partnership with USAID, Johnson & Johnson, the United Nations Foundation, and Baby Center. And what we do is we work around the world to get information directly into the palms of women who need it the most. Mobile phones are prolific, even in some of the hardest to reach areas. And many women, even if they don't have their own mobile phone, someone in their family does. So what we do is we take the best global health knowledge and we put it into what we call timed and targeted messages. So a woman would sign up for our messages that are staged to right where she is in her pregnancy or the age of her child. And she'll receive a message 2 to 3 times a week on her phone that is culturally relevant, is not just factual, but actually encouraging and helps dispel local myths and norms, and is in a format that she can understand. So many of the places where we work, women are illiterate, so we push voice messages to those women. In other places like South Africa, women are quite tech savvy, and we have a Mobi site that women can access for free. So it's been a really amazing way. In just 3.5 years, we're reaching over 2 million women in India, Bangladesh, South Africa. We're just starting a program in Nigeria. And then we're also testing some of the new ways people are getting information on their mobile phones. We have a partnership. We're one of the very first content partners with Internet.org. And we know that we're probably not reaching the hardest to reach people just yet on that format, but we're testing it to see, we expect that in the next 3 to 5 years, people will have Wi-Fi web-enabled phones, and we want to make sure that our content is available to people in whatever format they're receiving it on their phones. And we've also found it's just really important for women to engage their husbands in this conversation as well. In places like India and Bangladesh, women often aren't allowed to have their own phone. There's a lot of suspicion about who a woman would be calling or talking to. So our messages, we send messages directly to the husband as well. And we find that we hear all over the world that they're having conversations with their husband. They'll get the message. In India, for example, usually it is on the man's phone. So we have a little jingle. It's the sound of a baby gurgling, and it's a little jingle. And so as soon as the husband picks up the phone and hears that jingle, he goes and gets his wife. And then they can listen to the message together. And we hear women telling us everything from, my husband heard the message about me not being I shouldn't be carrying water on my head when I'm 8 months pregnant, and he'll pick up some of the household chores that I've been doing. Or my husband didn't think that I should be going into a clinic for birth. I just heard in Nigeria, one of the major reasons women don't get assisted birth is because their husbands they're afraid a man's gonna see them naked. So we can really figure out what those local issues are and dispel those myths directly in a way that is positive and supportive to the husband and to the wife, knowing that the wife often isn't the one that's making the decisions. I'm pretty sure everyone in this room has a mobile phone. So take out your phone and text MAMA in all caps, MAMA, to 313131. And you'll get an example of one of our family planning messages. So we have a set of messages. So right about 2 weeks after a woman gives birth, we'll start sending her messages talking about the changes in her body and how they will affect her fertility. A few weeks later, we start to talk to her a little bit about exclusive breastfeeding and fertility and thinking about different kinds of contraceptive messages. So for all of you who've just texted, this is one of my favorite messages, actually. I'll read it out loud because it actually gets to the core of why a lot of women end up having babies spaced really close together. It's because they get a lot of pressure from their husbands that having multiple children is proof that he's strong and he has a strong seed. So this message actually says, your partner may feel he needs many children to show he has a strong seed. Remind him that his baby is a fine example of his strong seed. So that's an example of how we get the message out. And then, the next message she might get would be one that's more about a contraceptive method that she can use. So we intersperse the information.
But I'm taking off my UN hat and saying, as an American citizen, you can let your elected officials know how important these programs are and that they deserve political support and funding. The United States is the largest provider and supporter of family planning and reproductive health programs in the world. It's something that most people don't know. It's actually foreign aid in this country is less than 1% of the federal budget, so it's not a huge amount of money, but you should feel good to know that it's directed in good places. Unfortunately, that is continually under attack. And next week, for example, my organization, UNFPA, is doing a big symposium on midwifery, which is the kind of work that all of us want to support, but at the same time, congressional opponents to these kinds of programs want to spend the whole time talking about trying to cut this funding. So contact your member of Congress. I know that the Better World campaign can tell you who that is if you don't know, and say that you support women in the developing world getting these services.
We're going to be soon rolling out kind of a theatrical on-demand release of this film, so you can bring the film to your community, do a screening, try to get people in a room to talk about these things, and we're going to be working closely actually with the UN Foundation to try to, we'll be working closely with the UN Foundation and the UNFPA so that if people want to get involved, we'll direct you to some of these good some of this good advice Sarah just mentioned. But if you go to the takepart.com/misconception website that was up there a few minutes ago, there's a button you can push. I'd like to organize a screening for the film. So we're going to start rolling that out soon and encourage people to use this film to really bring these stories out to a U.S. audience.
In addition to getting contraceptives out there, is also what we call demand generation, and letting women know that those contraception devices are available, why they're important, and that they can go to their local clinics to get it is another important piece of the policy and the funding mix. And also just to flag that MAMA will be part of something called the Global Moms Relay that is also sponsored by United Nations Foundation. That goes from Mother's Day to Father's Day, and MAMA is featured during the first week of that. And that's a really great opportunity. It's all pushed through social media, through the HuffPost, and it's a great way to donate, to share, and to spread information and advocacy around. So look out for Global Moms Relay starting on Mother's Day.